Well, there are some types of transference you could say. You could say there is simple transference. That's something that happens maybe only once or doesn't have a lot of complications. Something like remarks, for example, that people make. But it can also be more complex, and then it can be an interaction between both the client and the transference.
If you can give us a few tips. How do we recognize transference and countertransference?
Told me that you could help me, with the emphasis on you. So immediately some pressure can be put up. Always try to do is to ask about how do you feel in that session, how do you behave in that session, and is that different from other sessions with the same client or with other clients. But of course this could also be examples of actual sexual transference, that they were actually aroused by me, having fantasies
Share
about
with us,
me.
Which cases have you realized for yourself that make you vulnerable to transference?
What is it? Well, countertransference is that the therapist loses emotional objectivity and transfers feelings back to the client. So things like that you notice, hey, this is maybe not really bad behavior, but it's different from anyone else, right?
So make also a connection, because in that moment I think my clients knows that I know that I'm really there.
I didn't tell her, okay, you can't call me by my first name, because actually I don't really care about that. I often say to patients, it's fine that you call me by your first name. But the fact that she started doing that before we discussed it, that was different. And so I noticed that I do more for him than for others, and that it is hard to keep following the treatment plan.